We are the CAT8, also known as the Community Assistance Team 8.
Is a group of Jain individuals and professionals
who are assisting the community at large
during the COVID-19 crisis.
CAT8 began just before the COVID-19 crisis,
when it held a can challenge,
where children created iconic monuments
using cans of food,
raised some 3 tons of canned foods,
enough supply for 4 months,
for the Watford Food Bank,
run by the Trussell Trust.
During the COVID-19 crisis,
CAT8 is helping the elderly, the vulnerable,
those in isolation and key workers.
With meals, essential shopping,
help with medicine collection,
and someone to talk to
whilst coping with isolation.
CAT8 has lined up
a series of webinars.
In addition, we have created a helpline
for individuals and businesses
that need guidance
on the various government schemes.
And the topics of the webinars.
CAT8 is working with
or supporting various organizations,
including Go Dharmic,
Sevate,
Navnath,
SCVP,
One Jain,
the Trussell Trust,
and working with many volunteers.
CAT8 is the newest network fiber,
connecting the community. Our speaker today is Aaron Woodridge, a health and safety consultant at Marsh Commercial. Aaron has been working as a health and safety professional with over 22 years experience gained within the private and public sector, beginning his career working as an enforcement officer for both local authorities and the HSE. Aaron has worked across a multitude of sectors, providing bespoke health and safety consultancy and training. His clients include leading international companies. With the experience Aaron has, he can see through the complexity of very difficult safety issues, recommending and leading a course of action. So let me hand you over to Aaron. Khalid, stop sharing. Thank you.
Well, good evening, everybody, and namaste. And thank you very much, Rumit, for your kind words and your introduction to this evening's presentation on COVID-19 returning to work, which is a guide for business. Although I should say at this point, it's looking at the perspective both from the employer and the employee, and looking at the risk assessment process, helping for both employers and employees returning to work. Now, I'm sure most of you would have heard the often repeated words recently, living in unprecedented times. And tonight is certainly no exception, and it's not different for me, as this is the first time I have given a virtual presentation. Despite presenting training courses and running training courses for over 25 years, and this may well be possibly my largest audience. Now, normally I would be scanning the audience faces, eagerly looking for clues, adjusting my presentation based on audience participation, whether there's any blank expressions or people perhaps stifling a yawn, and thinking about the speed and delivery, always ensuring the content is pitched at the right level. Unfortunately, I do not have this luxury tonight, so I'm going to have to make a few assumptions. So firstly, I'm hoping that the audience, you are all well and you are keeping safe, and you are all willing and eager participants. And I'm sure you will all have your own individual aims on what you're hoping to get or achieve from this presentation. And as Rumit said earlier on in the introduction, there will be a question and answer session at the end. So if you do have any points that you require further clarity or any other issues that you require help on, then please put those questions in the chat, and then hopefully myself and the panel will be able to answer them later on. Now, I know a lot of the information which I've put on the presentation tonight has been sent through to the organisation and will be available for you to download and digest at your own leisure. Secondly comes the apologies. Now, I'm sure there are many of you who have joined tonight who will have different levels of knowledge and experience concerning health and safety, and also with COVID-19. So I've tried to pitch the presentation, providing a brief insight into the legal compliance for businesses, helping businesses and employers with their risk assessment process, as well as employees, and hopefully some practical information for everybody on how to work safely. Now, naturally, there are many different types of business, and it is impossible for me to provide bespoke, tailored information in such a short presentation. So the presentation is very much generic in its nature. Although the good news is that the sector-specific guidance, which we will be looking at later, is also generic. And that looks at the principles and considerations that businesses need to take on board before bringing back their employees. Therefore, by definition, one of the key principles for both employers and employees is flexibility. And as the government has said often, we are all in this together. And it's really up to everybody to play their part in reducing the risk of infection and the transmission of the virus, both in the workplace and also outside work. Finally, may I apologise for those who may have a slightly nervous disposition for invading your computer screens, looking like somebody from Castaways with my lockdown beard look. It's not my normal work. So let's move on to the presentation. Sorry, my apologies about that, a slight technical hitch early on. Here we go. So normally I would refer this to as my contents page. So these are the sections and the topics which we're going to be looking at tonight. So we will need just to touch a little bit on the law, and more importantly, looking at the sector-specific guidance which is available to employees. Now, naturally, with the limited time we have available, it's not designed to give you an in-depth perspective or presentation on the legal aspects. It's just really just to touch on it. We'll be looking at the consultation and communication process, which is really most important. Home working arrangements as well. So even though the presentation is aimed at getting employees back to work, there are still some very relevant points about how businesses should really help people or their employees to work from home where they are still able to. Risk assessments is probably the most important part, and we will be spending quite a bit of time looking at the HSE guidance on risk assessments and really how we can turn those risk assessments and the guidance available into practical measures for your workplace. We will also be touching on the use of personal protective equipment, also covering face coverings. And then finally, finishing off with further guidance and questions and answer sessions. And I guess really the aim and objectives for me in this presentation is really just to allow you to give you some information and knowledge on how we can help to reduce the risk of infection, and mainly to allow employees to work safely at work. So let's have a touch on the law to begin with. So I'm sure most of you will be well aware of the Health and Safety at Work Act And what this act does, it's a enabling act. And that really sets out duties for everybody. So for employees, people who import goods, people who design and manufacture, everybody has a duty under the Act. By virtue of that, what it also means is that it's very much a shared responsibility. So in order to make this work, it's a question for both the employers and employees working together and coming up with the risk assessments to make sure that it's applicable to your own individual business. So it places duties on everybody. Now, under the COVID-19, it doesn't place, there's no new legislation specific to health and safety. Now, I'm sure that some of you will be aware that we have recently had introduced the Health Protection, which is the Coronavirus Restriction Regulations 2020. Now, what that does, that's more to do with public health, and that places restrictions on businesses, people, and movements. So I'm not really going to focus too much on that at the moment. So other key points of law are looking at the management regulations. And for those of you who have some knowledge of health and safety, I'm sure you will be aware that under section 3.1 of the regs, then we have a duty to carry out what they call a suitable and sufficient risk assessment. And certainly the main brief of this presentation is looking at the risk assessments and how we can go about that. Now, I've also mentioned on the slide cost regulations, and for those of you who are very astute, then you will notice under the cost regulations, then it talks about, and cost stands for the control of substances hazardous to health. And part of that, then viruses, which is obviously what the COVID-19 is, would come under those regulations. So when we look at the law, the key duties are that we have a duty, and it's a duty of all employers so far as is reasonably practicable to protect the health, safety, and welfare of all employees whilst at work. Now that's under section 2.1 of the Act. Also under the Act, it also covers the self-employed and duties of non-employees. So that would entail your customers, any visitors, maintenance staff. So anybody you have coming on site, they would also be affected. Now, so some of the key sort of duties we're looking at and the guidance is looking at our 5 steps to working safely. Now, I will cover that and go into more detail in later slides and what that means for business. Now, hopefully on the right-hand side of the screens, you will be able to see the sector-specific guidance. And in this case, it's the one for offices and contact centres. So in order for the government to help UK businesses get back to work, then they have produced various sector-specific guidance, and in total there's 8 in total. And as you can see from the bottom of your slide, the different areas that they cover. Now, so for businesses, when it comes to this guidance, and the first thing I should state is that it's non-statutory guidance. Now, when we look under the Health and Safety at Work Act and we look at the regulations, then in order to support the regulations, we have a lot of what we call approved codes of practice, yeah? Now, the approved codes of practice are semi-legal documents whereby what it's really saying is that businesses are required to follow them. However, if they don't follow them, then it's up to the business to prove what they're doing is at least equal to that guidance. Now, with reference to our sector-specific guidance, as I've said, it is non-statutory. You've got these 8 different guidance, and the good news is that it doesn't really matter what type of business you're in, the guidance all follows the same format. So they're all exactly the same length in pages. They're 32 pages long. They start off with definitions about the business, and then it moves on to thinking about risk and how you manage that risk. It looks at who should be returning to work, paying particular attention to our vulnerable and extremely vulnerable members of society and your workforce. And then it looks at social distancing, how you're going to manage your customers and visitors, cleaning, PPE, which is obviously personal protective equipment, and then lastly looking at how we manage the workforce. So that's a little bit about our guidance. So the next thing we're going to do is just have a look at the Health and Safety at Work Act and what are the duties of employers. And once again, I would apologise if you've come across this and you know all this already. So the first thing is looking at a safe place of work, a safe site, and a safe environment. So depending on your business, so looking at your different sites, you might be working at different construction sites, you might be going away to different businesses, yeah. You may be looking at different work environments. So some of the key considerations you need to look at is looking at if you're working in an enclosed environment, whether you're looking at working in confined spaces or perhaps if there's any restrictions, because as we already know concerning COVID-19, there's a higher risk to your employees when you're working more in an enclosed space. Another key duty is making sure that we provide safe access and egress to work. So particularly if you're in a large business where you've got people congregating and where you've got a high throughput in employees or members of the public, then that could create problems, particularly with social distancing within your workplace. So we need to consider how we get safely to and fro our place of work. Safe plant and machinery, well, once again, even though we've been under lockdown and many businesses haven't been able to fully function or they've been working remotely, we still have a duty to maintain our plant, machinery and work equipment. So in particular, if you're looking at things like if you do have lift or lifting equipment, or maybe even your mains fixed electrics, and if they're due for maintenance or their statutory testing, then it's important that you maintain the frequency of those tests, yeah? And that's something which the HSE, which is the enforcement agency, have stated on their website. So there's really no let up in that regards. Safe systems of work and risk assessments, well, that's one of the key fundamentals of health and safety. It's enshrined in law. We also have the management regulations which deal specifically with risk assessment. And when we look at the guidance, our sector-specific guidance is all about risk assessment. And we'll be looking at that in more detail in just a couple of slides' time. Safe use and storage of chemicals and substances. Not really a lot to say on that. There's no real major big implications there concerning COVID-19. Ensure staff are competent and trained. Well, throughout all of the different health and safety laws and regulations, then staff training and competency is a key element of that. So what the law actually talks about in more detail is looking at making sure your staff have access to information and communications. Apologies, we're just losing it here. So, slight technical hitch there again. So, we must make sure that we give information, instruction, training and supervision to our staff, and that's exactly the same with COVID-19. So one of the documents which I've put for, which you can download later, is Toolbox Talks, and you can use that to help your employees, giving them briefs and safety information concerning COVID-19. One of the other key points of the Act is making sure that we have regular consultation, communications, and we have health and safety policies in place. So these are some of the main duties of our employees, but not also forgetting that we do have duties for our employees, and that's also enshrined in law. So each employee has a duty to look after their own health and safety, as well as of others, either by their acts or omissions. So that's particularly relevant. So when they do come into the workplace or when they return back to work, if you have got local procedures in place concerning, and these might be with reference to cleaning or sanitation, or your one-way systems you might have introduced, or any local procedures, and they have a duty to follow them, yeah? It's not something that they can just turn around and say, hey, this is nothing to do with me. So everybody has a duty under the law. They also have a duty to, if they see something which is wrong, to report it to you. And I would like to think that most of this within our sort of in environments or our work environments, that the way this is really going to work is for everybody to work together. And as I said earlier, health and safety, and with COVID-19, it's no different. It's very much a shared responsibility. So we looked at the duties. Now, within those duties, the vast majority of them within the legal text is preceded by the term so far as is reasonably practicable. Now, when we look at reasonably practicable, we need to look, and you can see from the scales here, you can see that we've got risk on one side, and on the other side, we've got the time, notes please, we've got the time, the cost and effort in order to put it right. So if we consider that we have the risk, and the risk is COVID-19, yeah, which is the risk of transmission. Could you just excuse me a moment? Notes page. So we have the risk of transmission, and we have the risk of infection from COVID-19. Now, the risk will vary depending on the nature of it, which we need to consider our work activities. We need to consider the notes pages, please, our work activities. And yeah, sorry. So let's restart that. So we're looking at the risk here. So it's so far as reasonably practicable. What this allows for is it means that business has to take in the nature of the risk, yeah. We need to look at the size of the business, yeah. We also need to consider our employees and whether any of those employees may be considered as high-risk employees, or they could be clinically extremely vulnerable as defined by the government and NHS guidelines, yeah, or they may be nursing mothers or pregnant women returning back to work. So the risk levels will vary, yeah, and we need to balance that against the time, the cost and the effort in order to reduce those risks, yeah. So within the law, reasonably practicable, it allows for flexibility based on the level of risk. So we are now moving on to 5 steps to working safely. So the first thing that the government advise and what employers must do is undertake a COVID-19 risk assessment, yeah. Now, we talked about the sector-specific guidance beforehand, and each of those guidance, those eight different types of guidance documents, yeah, they follow the risk assessment process. So When undertaking the risk assessment, the most important thing that I can say to you is that you must consult with your employees. Now, I'm guessing that most of the audience tonight, they may be business owners, yeah, and they may well be small businesses, perhaps without union representation or safety reps. But just a note there, if you do happen to be part of a large organisation and you've got safety reps, or indeed if you've got a union, then you have a legal duty to consult them. If not, then you must consult with your staff. So that's the first point. It also talks about increasing the cleaning and frequency of cleaning, hand washing and hygiene procedures that you need to put in place. So you need to have this in your workplace before you allow employees back to work here. So typical things you may well see is looking at having hygiene stations, the use of sanitizers at various points within your building and before you come into work. So at entrances and exits to your buildings, where you've got common areas such as canteens or restrooms, toilets, or it could be changing rooms if you're on construction sites, then you really need to make sure that you have these hand sanitizers readily available for your work, for your employees. Not forgetting that even though the presentation is looking at employees returning to work, the guidance still states that we should help people to work from home if they are able to. So there may be certain workers within your business, and obviously I don't know all your individual businesses, where it may be possible that they can continue to work from home. One of the key things is looking at your social distancing measures, yeah, and it's to maintain this 2-meter social distance. And you would notice on your screens, I've put in bold specifically there, where possible. So there are various exemptions to the 2-meter rule, and we will look at those as we go through the presentation. So if you can't maintain that 2-meter rule, what it's saying is that you must then manage the risk of transmission, yeah? So some of the key things that you need to look at that is looking at having increased hand washing and hygiene procedures. It will also talk about limiting face-to-face contact, which is obviously a big no-no. So you can work side by side, so you're not having that face-to-face or even back-to-back, yeah. Other measures would include things like using screens and barriers to separate people, and reducing, if that's not possible, then what you need to do is to reduce the number of contacts you have. And that can be done by using fixed teams or even partnering. So good examples of that may be, you know, if you are going out in deliveries or if you're going out to work in company vehicles, well, where you need to work as a pair, then you should really keep those pairs together, yeah? And likewise in teams, if you're working in offices and you've got maybe large departments, then try and keep the departments together so you haven't got people going throughout the offices and sort of walking from different areas where you've got an increased risk, yeah, of spreading any COVID, or the increased risk of spreading any possible COVID-19. So one of the key things which I've put on the bottom there is to follow obviously the government advice, and the universal precautions is to assume that everyone is infected. So I'm sure most of you will be aware there are people out in the community which may well have COVID-19 and they may not be aware of it. So they're not showing any of the common symptoms which are associated with COVID-19, and they may be what we call asymptomatic carriers. And of course, we don't know that. Nobody knows that. They don't even know it themselves. So once again, we've got to assume, and the safest way is to assume that everyone is infected. And the best way that we can take precautions about that is by increasing our cleaning, our hand washing, our personal hygiene, and obviously trying to maintain, where possible, the 2-meter social distancing. So let's move on. So if we look at the risk assessment process, and as I've said earlier, part of the government guidelines, sector specific, is undertaking the risk assessments. Now, hopefully, you may have some previous knowledge with risk assessments, and if we are undertaking risk assessments, then we follow what we call the 5 steps to risk assessment, which is the HSE guidance. So the first stage in undertaking the risk assessment is to identify the hazards. Now, the hazards, obviously, in relation to COVID-19, is the spread and getting infected by the virus. Now, that can come as a result of person-to-person contact. It could come from touching infected work surfaces, or even by sharing equipment. So those are the hazards associated with it, which is your first stage. The second stage is deciding who might be harmed and how. Now, the key thing here, which is absolutely critical, is looking at your employees and looking at who you're going to bring back to work and deciding whether, if any of them are clinically extremely vulnerable, and that's defined in the appendix in the sector-specific guidance, but it talks about people who have received a letter from their GP or who have been advised by their GP that they are extremely vulnerable. Now, if that is the case, then they really cannot work, or they shouldn't be going outside the home, yeah? And indeed, they should be shielding at home. The second classification of people is looking at what they call the clinically vulnerable. Now, these are people who may be regarded as aged over 70, regardless of any health condition, or adults who are under 70 and have underlying health conditions. It may well be that they've been told that they need the flu jab. So some of the examples of the underlying health conditions are things like chronic heart, liver, kidney, diabetes, it could be MS, or a weakened immune system, or it could be pregnant or nursing mothers, yeah? So those group of people, they are allowed to return to work. However, you should be undertaking specific individual risk assessments, yeah, and making sure that they're not going to be working in a situation where they can't maintain that 2-meter social distancing. Stage 3 of the risk assessment process is really looking at the evaluation of the risk and your existing control measures, and then deciding, are they suitable and adequate, or do you need to do more? Now, I would suggest, as COVID-19 is relatively new, that we won't really have any control measures or precautions in place at work to either reduce or limit the spread and transmission of the virus. So most of the procedures and what you're going to be implementing is going to be new, yeah? The stage 4 is recording your findings and making sure you implement them. Now, I know that sounds very obvious, but there is a legal requirement that if you have over 5 employees, then you must record you must have documented risk assessments. And the most important thing is to share them with your employees, yeah? And if you don't, so you should be consulting with them to begin with, and then once again sharing the findings of them and making sure that they understand and you're actually implementing the control measures. Unfortunately, there's quite a lot of times when I go into businesses and I would ask, oh, have you undertaken risk assessments? And they'll say, yes, they've done them. And then I'll say, are your staff aware of them? And they've never been shared. So it's really important to share that with your employees. The last stage is the review stage and making sure your risk assessments are kept up to date. Now, normally with risk assessments, then we would review them whenever there's any significant change, and normally it's good practice to do them annually. Now, obviously with COVID-19, the advice from government is almost changing day by day. So in particular with your workplace, in terms of the businesses which are now being allowed to open up. So recently we've just had car showrooms being allowed to open for business. The previous week we had garden centres, yeah. And I think I just heard on the news this evening, next week we're going to have zoos which are going to be allowed to open up as from Monday. So make sure you keep your risk assessments up to date. And one of the key things that I would also recommend is look at the advice on the use of face coverings and face masks. Yeah, so that is changing, and that changes from a regional and government basis. So I'm presuming most of our audience are UK based, but what I would say as a caveat is to always make sure you follow any regional advice which may be put out by your regional government, such as up in Scotland or the Welsh Assembly, or it may be your local NHS and healthcare authority. Another interesting thing, they also recommend that if you do have over 50 employees, then you need or you should be publishing the results of your risk assessments on the website, yeah? And once again, even if you have less than 5 employees, yeah? So it's saying you don't have to undertake a written risk assessment, but you still have exactly the same level of duty of care in law. The only difference is you don't need to record it. And once again, we all have this social responsibility to reduce the risk from COVID-19. And I think that's really, really important. And what's quite encouraging, and obviously now we are into, I think, week 10, week 11, since we've had the lockdown and the controls brought in, most of society have taken this on board. And I think by all accounts, the government response have been quite surprised by the level of uptake, and indeed figures would suggest that it's really helped to reduce the incidence and the number of infections concerning COVID-19. So once again, it comes back to a social responsibility. And when we look at law, then we have this duty of care. So let's move on. So what to include in the risk assessment? So firstly, we need to look at who can safely return to work. And the only way you can do that is by consulting and talking to your employees. So once again, people who may be classified as high-risk employees, and we've talked about that already. And some of those, if they're classified as extremely or clinically extremely vulnerable, then they should not be allowed to return to work. Vulnerable people as well, then you need to undertake specific risk assessments. So we really need to protect our high-risk employees, yeah? So, and the other key thing as well is we've got to understand that employees will have a lot of their own concerns as well about coming back to work. They may be living in a household where other members may be shielding, or they may have existing medical conditions, yeah, or they may be at risk. So there's going to be a fair degree of anxiety from employees before they come back to work. So once again, by doing a consultation and talking to your employees, then hopefully you can help to alleviate any fears that they may well have about coming back to work. If we look at some of the common employee controls, then we are looking at obviously hand washing. So the universal controls of hand washing cannot be overemphasized. It is really, really important, making sure that employees are washing their hands frequently. And in particular, whenever they're going into communal areas, which may be areas like staff restrooms, canteens, etc., then ideally you should be having hand sanitation stations before you go in and encouraging your employees to sanitize their hands, yeah, and once again before when they come out to sanitize their hands, yeah. So employee hygiene, and that also includes respiratory hygiene. So making sure that if we do have any coughs, colds, sneezes, that we're using tissues. I know it sounds really basic, but not everybody does. Making sure that we provide information for our employees. So in things like our restrooms, having hand washing signs, which you can download from the internet, and that gives you guidance on the correct procedures for hand washing. And it's these simple measures which are basic but are really, really important, which will help to control the spread of the virus. Social distancing measures, well, once again, where we talk about this maintaining 2 meters where possible. So depending on your business, one of the first things that I would suggest you would need to do is to look at any space constraints you may well have, and look at really how many people can you safely bring back to your organization. So for lots of offices now, you will be looking at things like having a gradual or a phased return to work. And some offices now are only just bringing back 10 to 20% of their employees, yeah. So there's lots of good things I've seen when I've gone out to businesses. So looking at either reducing the amount of desks that they have, looking at things, the positioning of their desks, so very simple things, by making sure they're spread out or they're not facing each other. If you've got customer fronting areas, things like your reception areas, then just looking at things like barriers and screens, which can very easily be erected. So at least that gives a physical protection between your employees and perhaps members of the public or visitors who may be coming into your premises. Some of the management issues are really looking at shift patterns, yeah. So if you have to bring back your employees to work, obviously, if we're trying to maintain social distancing measures, then you may well have to consider bringing back some employees. It could be on a rota system. It could be looking at having a staggered start times for your employees. And some of the areas which are, or some of the areas which are going to, could be more of a concern is looking at your common areas. So in particular, looking at your traffic routes where you have a high flow of traffic. So that might well be when you go into buildings, yeah, particularly if you're in shared buildings. It will be looking at things like your common touch points as well. So looking at things like your even simple things, your light switches, if you've got any security equipment or passes you have to go through. Looking at your restrooms as well. So some companies may well decide to take out things like coffee making facilities. And really you should be encouraging your employees to bring in their own food and drink to work. Is probably one of the safest bets as well. Where we've got, when we're looking at our work practices, then obviously we are trying to maintain social distancing of 2 meters, yeah. Now, there are going to be quite a few scenarios whereby that's not going to be possible. Now, within the guidance, and I say this constantly, it talks about 2 meters wherever possible. So what you should be doing is looking to really assess your work activities where they can't maintain social distancing, and really decide, is it absolutely essential that that is necessary to maintain your business? Yeah. So that's really your first consideration. Is the work activity essential? So there's lots of things which we can introduce now, and which has been introduced. One of the things tonight, we're doing a virtual presentation. Lots of meetings now are carried out by Zoom or by using Microsoft Teams, or perhaps even teleconferencing. So you don't have to actually get all these people in a close environment. So there's lots of different measures that can be taken there, and that's obviously going to vary depending on your work situation. So when we do the assessment, then the aim of that assessment is really to reduce the risk. And the most common mitigation factors for reducing that risk is looking at the increase in your hand washing and sanitation and cleaning. Looking at, if that's not only that, but looking at how you work and whether you can work either side to side or even back to back, but definitely try and minimize working face to face. Now, in some situations, particularly when we're looking at maybe construction industries, there is a lot more face to face working. Now, there is guidance, and this first came out and got published by the Construction Leadership Council in conjunction with Public Health England, and it talks about, if you do have to work face to face, then obviously you should limit that to the amount of contact, so partner up with people, work in teams, and ideally it should not be for more than a period of 15 minutes at a time. Yeah. Now, within all of the sector specific guidance, it doesn't put a time span on it, and that's the only place where I've managed to find out that 15-minute rule in. Interestingly enough, in our own works guidance and looking at the guidance from the Communicable Disease Control in Atlanta, that also talks about close contact being 15 minutes. So I'm just conscious of our time now. So there's lots of practical measures you may be able to take, looking at your layout of rooms, increased cleaning, equipment, and the main thing there is that you shouldn't really be sharing equipment. And if you do have to share equipment, then you should be looking at making sure you disinfect that in between use. Not forgetting any work-related travel, and just thinking about how your employees are going to get to and fro from work. Just conscious of the time, so I'm just going to quickly finish the last couple of slides. So, the provision of PPE and face coverings. Now, as you can see, and once again on your slide, I've highlighted it in bold. So, when we talk about personal protective equipment, and particularly the use of respirators and face masks, then these should only be used in clinical and healthcare settings. Now, the only exception to that is unless your employees normally wear RPE or PPE as part of their work activities. Now, I'm quite conscious that there's been a lot of debate on face coverings, yeah? And only recently, last week, the World Health Organization changed their guidelines on face coverings. And I know the Welsh government have introduced different guidelines compared to the English government on face coverings. So essentially, face coverings should only be used when social distancing cannot be maintained, i.e. you're working in an enclosed area and you're working with people you do not normally work with or you don't normally mix with. So obviously, if you are using working in a confined space and you're working on a building site where you've got lots of different tradespeople, then that would be a example of where you would need to use a face covering. There are guidelines for using safe coverings, and indeed, my own personal view that unless it's actually done correctly, there could be increased risk from wearing them. So what people tend to do is fiddle with them a lot and touch them because maybe they're itchy, they're not used to wearing them. And then once they're doing that, well, they then start touching and other areas. And if they have got any symptoms, unbeknown that are symptomatic, then they're just going to be spreading that virus, yeah? So it's really important that you follow the rules for the use of face coverings, yeah? So just to finish off very quickly, on this slide, it talks about there's lots of further guidance and information available. The overriding thing that I would say to you is to make sure that your employees and the employers keep up to date with the government guidance, and I've put the links on there. Also bearing in mind that depending on where you're located, you may have regional guidance up in Scotland, which could be different to our guidance, and in Wales. So make sure you are aware and following any regional guidance. There's also guidance from the NHS, particularly with the new procedures now for test and trace. And then most importantly, you've got the working safely, the sector-specific guidance, and then there's lots of information on the HSE website, also on our own web pages. And then the last one I put in there is mine, not forgetting that there's been lots of issues with the social and mental well-being, particularly with employees who have been having to work at home. So that's a really, really good organisation. So finally, thank you very much for listening. I hope you found it useful and informative, and I'm sure you must have lots of different questions now. And my apologies if I haven't covered all of them in the presentation. So that's it for me. Thank you very much. I think now we will hand you back to Rumit, who will be looking at questions and answers.